Welcome back to Lois. Oh, sorry, that didn't work. Welcome back to Lois. I'm learning how to talk today.
Okay.
Welcome to Life Choices, and thank you for joining us today. I have an incredible guest for you. His name is Dr. Ian Yamane, and he's a functional doctor, and I bet you don't know what that is because I didn't when I met him. So welcome, Dr. Yamane.
Thank you.
So nice to have you here with us. Would you tell me what a functional doctor is?
Yeah, absolutely. A functional medicine doctor deals with the root cause of a condition or a disease. So when you go to a traditional, conventional medical doctor, they're looking for a specific diagnosis when you go in for an office visit. And when they're able to identify that, then they can give you a particular medication or they can do some type of procedure on it. But it really doesn't get to the root cause of the problem. So with functional medicine, it's all about creating more function for the body and removing the interference to allow the body to heal itself.
Now, what made you decide to become a functional doctor rather than a traditional doctor?
You know what, it stems from growing up. I grew up in San Diego, and my sister and I, we thought we had a healthy and happy life with our family. But unfortunately, my mother was always missing from that picture. She was always bedridden with we didn't understand, but she was just always sick. She had no energy, and my dad would always bring home medications each time they went to the doctor's office, and none of the doctors really knew what was going on with her. My father would take my mother to all the different specialists in Southern California, to UCLA, to the Scripps Center, you know, all
They have some of the best medical facilities in the
absolutely.
world down there, yeah.
Absolutely. And every time we were hopeful that she would get better because my father would bring home a big bag of medicine. And each time she would get a little bit better, there was a glimpse of hope, but then all of a sudden she would just go right back into bed. And this would happen over the course of many years when we were young. And finally they said, you know what, we're fed up because the medicines aren't working for her. She's not getting any better. So they were introduced to more alternative medicine. So they started to go into different holistic doctors, to acupuncturists, chiropractors, naturopathic doctors, and it seemed to give her more energy. But what ended up happening is she died at an early age just because of all the complications that occurred. She had a heart complication, and so she passed away early. But that motivated me when I was young, and what she told me was to, you know what, why don't you get into more alternative type of functional medicine and really find out what the root cause is, because no one's able to find that for me. And that would be wonderful if you can do more than just prescribe a pill. And that's what I did. That's what motivated me to get into functional medicine.
It's very interesting what you do, because when I came to you, I went to one of your lectures, and you were an incredible speaker. I have to say that.
Thank you.
I didn't expect a doctor to be that good a speaker.
I appreciate it.
But you were incredible. And because of that, I wanted to find out more, and I came to you. And I was amazed that the very first thing you did was an incredible amount of blood tests.
Yeah.
Yeah, what was that all about?
Yeah, so that's another differing aspect between conventional and functional medicine. With your conventional medicine doctors, they're looking to diagnose a problem. So they're doing the standard testing that they normally do to rule out liver, kidney, digestive type problems, anything significant they're looking for. With me, I'm looking for something more underlying. What causes those conventional markers to be flagged? And so that's why it requires different types of testing, more advanced testing, to find out what the actual root cause is. Because you could have certain infections or chemicals like heavy metals mold, environmental toxins like plastics, and other types of environmental chemicals that can be causing the inflammatory process that in turn would be causing the condition or disease.
Or pain.
Or pain, absolutely.
Or pain. I know that I had a lot of pain when I came to you, and I was really stressed out as well.
Yeah.
And yeah, you remember.
Absolutely.
And that really helped me a lot to figure out what was wrong with me, what was underneath what was going on with my health problems. And I feel like now today I'm so much healthier than I was back then. Of course, now you had me take about 1,000,000 kinds of pills.
Yeah.
What's that all about?
Yeah, so that's a common complaint that I get from my patients. But what it's all about is providing the body with the raw material that it needs. So everything's natural. So it can comprise of herbs, botanicals, vitamins, and minerals, just rich in nutrients. And we have to flood the body with these ingredients so that your body has the ability to take this raw material so that it's able to heal itself. So the first stage of a treatment protocol is to eliminate the interference where the body is unable to heal itself. So once we are able to identify what the interferences are, or what I like to call what's in the bucket, because you have a lot of trash that gets compiled over the course of our lives, whether it's breathing in bad air from a polluted environment or through eating packaged foods because the plastics and the packaging tends to leach into the food. We have plastic water bottles that we drink from. So the toxic exposure is unlimited. But the question is how well does our body have the ability to eliminate these toxins as it enters the body? And so the problem is that a lot of the excretory organs becomes overconsumed because it's so busy working overtime trying to eliminate all the toxins that it starts getting worn out and tired. And so at that point, it cannot keep up with the toxic load and it starts to increase its load in the body, and that's what creates the sickness. So when we bring in all of these powerful nutrients, then the body has the ability then to have the energy and the ability to clear out the garbage out of the body and at the same time heal itself from all the work that it's been doing.
Wow. When a person is older, like over 50, like many of the people watching my show, and like me, a little bit older than 50, what should we consider when we're looking for a doctor? What should we think about that we should ask, or what kind of questions should we ask when we come to you?
So that's a great question, and I'm not knocking conventional doctors by any means, because conventional doctors, they care about you, they want to help you, they want to assist you in your lifestyle so that you're able to function appropriately. And that's what medications are for. For emergency situations, the medications helps you to live to a day-to-day ability. And that's fine, but being on a lot of those medications, particularly if you have chronic disease like diabetes, dementia, like early stage dementia, cardiovascular disease, GI issues, oftentimes you're on these pills for a long time, for decades, and maybe for your entire life, and that tends to cause side effects. But as I mentioned, if you need it from your doctors, then by all means take it, but at the same time you want to figure out what the underlying cause is, because if you can eliminate the underlying cause, there may not be the necessity to take those medications for the rest of your life. I never take my patients off of medications. I have them work with their doctors who prescribed the medications in the first place. And those doctors are going to use lab testing in order to determine whether or not they need to take the medications any further. And that's what I go by as well, because once we eliminate the root cause of the problem through lifestyle changes, it really is what it is. Taking nutritional supplementation is just one part of it, but there's a whole spectrum of lifestyle factors that an individual has to make changes in a better way. And by so doing, then they're able to allow their body to heal itself. And once they reach that certain point, then we're able to confirm it on lab work. And their conventional doctors will see this as well. And by that, they will be comfortable in taking either decreasing the dosage or taking the medications away from the patients.
And you have like an eating protocol as well. You have nutritionists on staff.
Yes.
And do you give people a specific diet based on whatever you find is the
Yeah.
root cause?
And that's the key, is that we prescribe a specific dietary program, or what I like to call food program, specifically based on the lab work that we find. There's so much confusion out there, and there's a lot of good material out on the internet, or books that are written by other functional medicine doctors or nutritionists that are promoting, healthy eating. But the thing is, it's not customized to that individual, you see. And so whereas, like for instance, one of the big crazes right now is a ketogenic diet. So some people grab onto that, they eat a higher fat diet, low carbohydrate, and it works fantastic for them. They have less brain fog, they're losing tons of weight, they have a lot of energy. But then you have their good friend or family member doing the same exact diet, and they're getting the opposite effects. You see, and so something's going on from a underlying standpoint that for that individual, that food plan does not fit. So the key is to do the testing in order to determine what would be appropriate for that person. And so all the popular diets out there, you know what, they can be prescribed for an individual, but that's where we really customize things, and my functional nutritionists help with this specifically.
Now, what do you think about this kind of trend that is going on right now about this intermittent fasting? I have a girlfriend who came in, she said, well, I only eat between this hour and this hour, and I'm fasting. Now, is that good for a person to do that or not?
Yeah, great question. So once again, it depends on the individual, but it is a popular type of what I call advanced strategy, because what happens is when you apply this principle of, let's just say, eating within a 6-hour eating window and then fasting for 18 hours. So you can be starting to eat your breakfast/lunch at noon and cut off your eating by 6 p.m. It's not meant to be a caloric restriction diet, but it's meant for you to intake all your calories within that 6-hour eating window, and then drink nothing but water the rest of the way through. So it's a six-hour eating window, 18-hour fast. What that does is it gives the digestion a break, because oftentimes we eat too much over the course of the day. We think that, you know what, the more snacking we do, the healthier it is, but it's not necessarily true for all individuals.
Well, I think we were told that would keep our metabolism working, to eat a little bit all day long.
Yeah, and you know what? And for some individuals, that is appropriate. There's certain individuals that have glycemic issues where their blood sugars drop, so they have an underlying mechanism that creates that type of symptom or sign. And so for those individuals, they may need to eat every couple hours, you see, in that specific condition. But others, they can benefit greatly through this intermittent fast, because what it does is it gives the digestion a break, it gives the pancreas a break. You don't have any insulin surges by eating, throughout the day. And by doing that, you can increase the insulin sensitivity to the cell, and therefore keep your blood sugars regulated, because there's millions of people that have blood sugar issues, either being pre-diabetic or diabetic. It's a problem. And so by applying an intermittent fasting method, for the most part, is very effective in helping with the insulin issues and the blood sugar issues.
And you mentioned then the rest of the time during this intermittent fast, drinking water. Now, I can't tell you how many people I know that have health issues and that are overweight that say they don't like water. They're not going to drink water. So is it important for them to drink the water?
It is. About 70% of our body is made up of water, so we definitely need to drink water. The rule of thumb is to drink half your body weight in ounces throughout the day. And obviously, you want to cut off the water drinking prior to bed, about an hour prior to bed, so you're not getting up and going to the bathroom, because you don't want to interrupt your sleep, but you want to cut off the eating 3 hours prior to bedtime. But then as soon as you wake up, definitely hydrate, and then just keep a like a hydro flask or some type of water bottle that's non-plastic by your side, and just drink it throughout the day. You'll be amazed as far as the energy levels and the detoxification that occurs during that time frame when you just increase the water intake.
Well, I know that it's important, but I forget to do it. And so your nutritionist in your office had me buy a bottle on Amazon. It was about that big, and it had it marked like by 9 o'clock you drink this much, and by 11 o'clock you drink this much, and that really helps. Because I can see if it's 11 o'clock and I haven't drank any water, oops, I better drink this much water now. And that's helped me a great deal, but I'm still really bad on that water thing. But it's not because I don't like water, it's because I get busy. I get so busy during the day, and so now I set the alarm on my phone to remind me to get up and go drink the water. That's an important part.
Yes.
When I came to your lecture the first night, you were talking about hypothyroidism.
Yes.
Yeah, what is that?
It's a condition where your thyroid hormone levels are low in the bloodstream. So your doctors, typically your PCP or endocrinologist can do a thyroid panel and check your TSH levels. And if it's high, that's saying that, okay, the brain is needing to produce more thyroid hormone, suggesting that you have hypothyroidism. And that creates a big problem, because the thyroid hormone, I mean, literally in every single cell of your body, you have a thyroid receptor site. And so your body relies on this thyroid hormone. And a lot of women have this hormonal issue that creates energy loss, hair loss, libido issues, skin problems where it's too dry, weight gain, digestive problems. It can cause a whole slew of problems. So that's why it's really important to regulate the thyroid levels.
I see. Well, when let's say a person gets in 50s and 60s and 70s, and they start to gain weight, and they go and they have blood tests or whatever, and the doctor says, well, it's your hormones. This is what's causing you the problem. And maybe your testosterone, for women, the testosterone is way too low. But they say, well, we can't give you any of that because you've had cancer before. So what does that person do?
Yeah, so that's a great point. We tend to blame weight gain or whatever other conditions, especially in that age group, on menopause, right? And what is menopause, or premenopause, or perimenopause? It's all about a hormonal issue, and we tend to blame an increase in estrogen on cancer production, and it's legitimate, because if you have a estrogen to progesterone imbalance where you have too much estrogen and too little progesterone, then it'll cause an overgrowth of tissues. So you can have cyst formations or fibrotic formation both in the breast and the uterus, causing PCOS. And so
what's PCOS?
It's
Sorry. I just don't know what it is, so I'm wondering maybe people out there don't know either.
So it's a condition where when you have too much estrogen in the system, it creates an overgrowth in the tissues, particularly in the reproductive tissues. So it can happen both in the uterus and also in the breast tissues. And what happens is then it can cause excess bleeding that occurs. And so when you go to your OBGYN, then they can essentially diagnose you as having that particular condition, and will offer certain types of conventional type procedures, either to do some ablation or some type of invasive therapy, or hold off and give you some hormones to make some adjustments in through that area. And so that's a conventional approach. But from a functional approach, going back to your question, as far as what we're able to do, we need to always ask the question as far as why. Why are the hormones, or why specifically in this case do you have an imbalance of your sex hormones? And oftentimes it's, well, I would say 100% of the times it's an inflammatory condition. But then you got to ask the question, well, what's causing the inflammation? What's causing the forest fire in the body? And that's where you have to look into that bucket, right? The bucket represents the cell. And over the course of life, you tend to accumulate all these different toxins that I mentioned earlier that's in the environment that we may have no knowledge of, but it occurs in our body without us thinking about things. It just accumulates in our body. And that's what we have to look at. So yes, it's important to assess what's going on with the hormones, but that's more superficial because the hormones can definitely create symptomatology, but we have to consider what's creating the hormonal imbalance. And it's all about, what is the root cause? And that's what we tend to address in implementing different lifestyle changes.
Right.
And by doing that, it downregulates the inflammation or that forest fire in your body, and then that will allow your body to produce or to have balance in the body. And oftentimes what we see is we see a regulation of your estrogen, testosterone, progesterone going back to the normal levels without having to rely on hormone replacement therapy.
Are amino acids a part of that, or what?
Amino acids are part of the nutritional requirement of our body, so that's really important. Amino acids are part of the building block of our tissues and muscles and tendons, etc. And so it's a key part of the healing component of the body.
Yeah. When I went through cancer about 9 or 10 years ago, the doctor that I had at the time told me that when he went through medical school, he only had about 4 hours training on nutrition. And that's why he sent me to someone else to learn about food and nutrition. And I find that interesting that the traditional schools don't teach doctors about what we put into our body, only how to fix. I mean, I'm not asking you a question there. I'm just making a statement that I find that interesting that, health and wellness people are not learning about what we should do to prevent getting ill. And a lot of what you do is to help us figure out what's in there and to prevent being that way in the future, right?
Absolutely. Yeah, and that's why conventional and functional medical doctors should join forces because it complements one another. When an individual has some severe symptoms, that's where medications come in handy, and I'm definitely a proponent for it. If a person comes into me first and they have all these symptoms, oftentimes the more natural, functional approach, it takes time for the body to get rid of the garbage out of the body, and it takes time for the body to heal appropriately. So in cases like that, you may need an emergency situation where in those cases, I do send to a conventional doctor. I work with several to where they can be on medications to give them relief for the time being, but at the same time, we can work on the root cause of the problem. So there are several different specialists in the health field, and so not one field can know all things.
No.
That's the benefit of having different specialists. With conventional docs, they're great at diagnosing a problem and giving the appropriate medication to suppress the symptoms and to manage the disease. The problem is the system that's in place in regards to managing chronic disease, all it's doing is managing it. It's not taking care of the underlying problem. So you take a person like diabetes, and you're on your first set of medications, and initially it may work, but then your body will develop a resistance to it. Then on to the next medication, and to the next one. And then at the end, you're on insulin. You're pumping yourself full of insulin, and then you're increasing the units routinely to the point where there's no more answers. And I see a lot of those patients come into the office where they're just getting frustrated because none of the medications are working anymore. And the reason for that is not meant to be used in that way or for that long, you see, but there's no other solution when it comes to a conventional approach. From a functional standpoint, it makes tremendous difference when we can change that individual's lifestyle and the blood sugar numbers start coming down. And then at a certain point in time, once the body heals itself, they don't need to be on the medications, you see. But for a short term, yes, it may be appropriate. And that's where both specialists can really benefit that particular patient or individual.
When you say lifestyle, you're not just talking about food then. There are other things that we need to change as well.
That's correct.
Like?
Absolutely. So we talked about supplementation, which is huge because we don't get enough nutrients in a case of a person that has a condition. If a person has a condition, they have certain mechanisms in the body and damage that's not working. So food alone is not going to heal the body. That's where we have to bring in the nutrition. But just as important, I mentioned sleep earlier, it's really important to get a good night's rest. That's where the body is able to rejuvenate and to heal. And if you're not sleeping 7 to 8 hours per night, ideally uninterrupted, you don't have that ability for the body to rejuvenate and to refresh itself so that the next day you're ready to go. What happens is all your hormones become regulated and different types of chemicals gets replenished, and if you don't have them when the day starts, then it's going to lead to problems, particularly if it's day after day after day. So that's a really important lifestyle factor that we need to look at, because if there's sleep issues, it could be an obstructive type of problem where one may need a CPAP machine to help them sleep through the night, or may need to go to a dentist to get some type of hardware to allow the airway to be opened up by keeping their jaw in a certain position while they're sleeping. So it's really, really important that one gets a good night's rest. The other thing we can do is help with certain types of help aids as far as in the form of supplements. They may have a chemical imbalance where they have not enough of a certain chemical to help them sleep through the night, and so we may be able to help with that, but it's really crucial. The other thing is, and this is where another confusing point is exercise. A lot of people are confused about diet, but exercise can be just as harmful to the body. So we're very conscientious of foods to avoid, right? We know processed foods are bad, sodas, diet sodas, etc. We just know, right?
Yeah.
We know that certain foods are bad for us. Well, there's certain exercises that are bad for us as well. If we find through lab work that there is a forest fire in the body or a lot of inflammation, that particular individual should not be doing a lot of cardiovascular exercise, because I think we tend to think that, okay, I'm gaining weight, I'm trying to eat well, I'm exercising, well, I got to exercise harder. So I'm going to train for a marathon or a triathlon so I can be healthier. But what actually happens is it puts a tremendous stress on the body, and it actually makes that individual worse, you see. And so when we see that on lab work, we'll tell that individual not to do those types of exercises, but do more calming type of movement exercises like yoga or breathing exercises, meditation, walking around the block, doing some swimming. So just really, really low impact type of workouts that will definitely not injure the body.
Yes, I remember when you told me to sit in the bathtub with Epsom salts and then go jump in the cold pool outside, and and I did it, and it was cold too, and I was like, oh, I don't know how many times I can do this, but it helped. It really helped a lot. Yeah, it was great. So, Dr. Yamane, you're with Valhalla Wellness.
Yes.
And would you tell my audience how they can reach you if they wanted to contact you and maybe make an appointment to see how you could help them?
No, absolutely. You can go to our website at www.valhallawellness.com, or you can call our phone number at 702-658-0204.
Wonderful, wonderful. And about your book, you have a book that people could find, could buy, could learn. Time is Tissue, I think is the name of it.
Yeah. And so Time is Tissue, and the rest of the title is a systemic approach to reversing cognitive decline. And this is very prevalent in our society, especially those, the demographic from 50 and above, where there's a lot of brain fog or forgetfulness. And we tend to downplay these particular symptoms, but in reality, it's inflammation in the brain. And when we start having signs of that, especially when it's progressively getting worse, we need to do something about it, because the more time that elapses, the tissue in the brain actually starts to shrink. Because what's happening is your brain is trying to protect itself, the nerve fibers, against threats that are within the body. So in terms of Alzheimer's disease, from a conventional standpoint, there is no cure for it. But from a functional standpoint, if we can get a hold of an individual early enough, we can actually reverse that process through everything we've been talking about, through specific lifestyle changes. Because when there's a lot of toxic overload in the body, the brain wants to protect its nerve tissues, and it starts to hide it. And unfortunately, with all the medications that are being experimented with, particularly plaque reversing type of medications, which it's working, but the patients are getting worse in those particular studies. So there is no solution to reversing Alzheimer's or dementia type diseases. But from a conventional standpoint, there's been a lot of good research in using this type of method with functional medicine to reverse the process, as long as we catch it early enough. And that's what the book contains, is my approach to reversing this particular disorder.
Can people get the book on your website?
Absolutely.
Okay, wonderful. Because I think a lot of our audience that's watching this show, they're going to be very, very interested in that. Because I've never heard anybody refer to brain fog as inflammation before. So that's really interesting. I'm going to get the book myself. I want to read it right away.
Absolutely.
Okay, thank you for being here.
Yeah, thanks for having me.
It's been such a pleasure, and it's always a pleasure to be with you.
Thank you.
And thank you for being with us today. We really appreciate you joining us. I hope you enjoyed this program as much as I did, and that you'll come back and be with us again soon, and make good choices. Choices. We have choices. They are the source of the success in our lives. When things happen to us, we can choose to believe they happened for a reason. We can discover opportunities in the most difficult experiences if we are willing to look for them. It is what we choose to think about each experience that determines how we respond to it. How we respond determines whether or not we find richer, more purposeful, more joyful lives. We are the only ones who can choose our attitudes and the principles that we live by. Choose well, my friends. Choose well.